Hello everyone. This week we're looking at language disorders that include trouble with language as well as speech and voice disorders. We'll also look at stuttering and other types of problems with language. So we know that when someone has difficulty understanding others, they have difficulty with receptive language, and when they have a difficulty sharing their thoughts and feelings and expressing their language, both of those would be considered language disorders. There are also processing problems with language, and there are central auditory processing problems where language comes in, but somehow it gets muddled up and it doesn't get processed properly. These people with central auditory processing difficulties have a hard time staying focused. They tend to be fidgety in the classroom and easily distracted. They're the kind of people that would go, huh? Did you say something? And you have to repeat often. They have a difficulty time sounding out new words, or when they're reading out loud, they have a problem with pronunciation, and they will pronunciate things incorrectly for years, even after being corrected several times. So it's almost a listening disorder, but it is considered a language disorder because it's difficulty with processing and with receptive language. Auditory recall deficit, these guys have a really hard time. If you give them a grocery list, for example, they'll remember the very last thing that you said. If you give them a series of directions, like go to the grocery store and I'd like you to pick up bacon and eggs, peanut butter, milk, toilet paper, and pineapple juice. They will only remember the very last thing on that list. They can't keep phone numbers in their head. If you give them directions, they will get lost. They really need to use a GPS. They have a difficult time memorizing things, memorizing poetry. So it's auditory recall. If they watch you do something, it's much easier for them to follow your physical movements and repeat by watching, as opposed to repeating whatever it is that you tell them. So auditory recall deficit, these are the folks that really have to write things down, and so there are some simple solutions, but they tune out over time, and they can mangle words, and they just have a difficult time recalling oral instructions. Language processing, this is often a problem that we see with people that have autism, and it's an inability to understand humor. They get really disinterested. They don't understand idioms. So if you say it's raining cats and dogs, they would look at you and say, no, it's not. It's raining raindrops. Or if you say, oh, we're having a surprise birthday party for Granny, don't let the cat out of the bag, they would say, you have a cat in a bag? So they take everything very literally. It takes them an awful long time to answer if you ask them a question. And they get lost in terms of trying to follow a plot in a movie. So this again is a processing problem with language. There are many speech and voice disorders. You know that there are warning signs if people are not meeting their developmental milestones. So sometimes the milestones can be used when you look at what you would expect for the first 12 months, if someone is not doing one of these things, then that would be a red flag, and you would say to yourself, well, they're not following this milestone, so I'm a little bit concerned about them, and maybe they could go to a first words clinic or see a speech and language therapist. So the milestones that you got as a checklist, that's for you to keep for your career and use on children and be able to say, yes, this person or child is meeting their milestones, or no, this person is not meeting their milestones. So when we look at voice disorders, there can be problems with pitch and frequency, and pitch is the perceptual correlation that relates to the frequency. When the pitch of the voice is raised, the vocal cords are elongated. Frequency is sort of the vibrations of the vocal cords within a specific time period. Loudness and amplitude, you know, there can be some real issues with the air molecules against the eardrums, and somebody can just not even hear their own loudness and their own amplitude and not be able to modulate their own voice quality. Quality and complexity, these are the audible features of a person's voice, so you can distinguish the characteristics of somebody's voice from another person, and that's what makes our voices quite unique. Resonance is how the voice vibrates and how it sounds to others, and there are some voices that really stand out and that resonate in a very negative way and sound horrible. If you've ever watched, I think it was called The Nanny, there's somebody with just a horrible voice. She kind of talks through her nose, and some voices are quite pleasant to listen to and others are really awful. So you can have pathology within the vocal cords themselves. So this is looking down somebody's throat, and you can have vocal cord paralysis if you have Parkinson's or Lou Gehrig's disease, which is also more formally known as amyotrophic sclerosis. Multiple sclerosis can also affect the voice, as well as Huntington's chorea. You can have tumors and polyps and all kinds of things in the throat, swelling, ulcers, cysts. There can be little localized lesions or nodules. And so vocal fold pathology, where the flaps and the folds work together, can definitely affect your ability to speak. And I believe this is about vocal fry. I may have already shared this with you, but let's just see.
Adaptable animals on Earth. These days, coyotes are everywhere.
Young women are speaking. Experts call it vocal fry, and they believe Hollywood and reality TV could be to blame here.
As our Melissa Reed reports, it has some local doctors a bit worried.
I don't think it's asking for too much to stay in.
You've probably never heard of it, but you've probably heard it before.
It is my birthday. I'm allowed to have a little fun after all. Hi, guys.
Experts call it vocal fry.
That's so cute, or that's so pretty.
And it's creeping into the conversations of young women.
I love your makeup.
Vocal fry is when the voice sinks from the front to the back. It sounds kind of like bacon sizzling on a pan. So it sounds like this. Instead of saying, hello, how are you? We'd say, hello, how are you? I'm okay.
Dr. Nicole Moronian with the Laryngology and Voice Disorder Center at UH says she's seen more cases of vocal fry, also known as glottal fry, in young women.
in high schools and middle schools, I've noticed that a lot more. From my generation, I would just initially say, that's like a valley girl.
So why is this low-pitch way of talking so popular? Experts say pop culture.
I got into a fight with my sister's boyfriend.
It probably started back with Meredith Grey and Grey's Anatomy, where she had this very tired-sounding voice, was always dealing with lots of troubles and dramas, and I think that's now what we're seeing sort of with the reality TV shows and the Kardashians. Our young people, though, are seeing that very frequently and are modeling off of that voice quality.
I can tell when someone's watching it like in another room or something, 'cause it's just so like,
But doctors say that imitation can become habit, with consequences to the vocal cords.
One, it's fatiguing to use. Two, it can cause swelling and muscle memory so that you continue to use it. It becomes a habit. And three, it can cause lesions or other problems that may require more aggressive intervention, even surgery.
So can vocal fry be reversed? Doctors say absolutely. But you have to catch yourself doing it first.
Wow. And then I teach them how to correct that, which is really by increasing breath support and using some techniques called forward focus therapy or resonant voice therapy.
And while doctors realize that young women are just trying to find their voice, using that voice might not necessarily reflect what's on the inside.
They don't care, they're too cool, it doesn't really matter to them, this isn't important, and that's how loud fry will come off.
because they look up to them and then they watch them on TV and they just happen to mimic them. Maybe it's subconscious, but I'm really not surprised.
Fox 8 News.
People look up to the Kardashians?
Well, some people do, Bill. I know you've never seen that show.
I'm never going to watch that show.
So don't speak like Kim, who's ever so boring, needs a new handbag. It just makes you sound stupid. It's not good modeling for the individuals that you support, and it damages your vocal cords. So don't do it. So some other voice disorders are aphonia. That's anytime you see the letter A in front of something, it usually means the absence of, and aphonia is the absence of the ability to make or produce a voice, and that can be just a disruption to the laryngeal nerve. So voice is the sound that's made by the air passing from your lungs through your larynx or your voice box, and the two vocal cords are bands of muscle that vibrate to make sound. So most of us, our voice plays a big part in what we do, how we communicate, and it's almost like a fingerprint, and everybody's voice is unique. So there's all kinds of things you can do to damage your vocal cords: talking too much, screaming, constantly clearing your throat, smoking, singing, speaking for a living. All of these lead to problems such as nodules, polyps, and sores on the vocal cords. If you have disruption to the laryngeal nerve, it actually supplies all the muscles in the larynx, and damage to that nerve could be the result of surgery or a tumor, and so that would mean that you have the inability to produce any voice. Dysphonia is not quite as serious. Dysphonia is difficulty with your voice, so laryngitis or some kind of a tumor or trauma to the vocal cords, or you could have like some kind of bacterial viral infection in the vocal cords, some kind of carcinomas. You can have blunt sort of trauma or penetrating trauma to the vocal cord, or a crushed larynx. I know somebody whose larynx was crushed in a motorcycle accident, actually. And there can be endocrine problems, hypothyroidism or hypogonadism. And latrogenic is diet or environmental problems, breathing in some toxic substance or some kind of a wrong treatment. So this video looks at just how important the
swallowing occurs in two stages, the oropharyngeal and esophageal stages. At the start of a swallow, a food bolus is voluntarily pressed by the tongue up against the roof of the mouth and backwards towards the pharynx. In response to activation of pharyngeal pressure receptors, the swallowing center in the medulla initiates reflexes that prevent food entry into respiratory passageways. The uvula contracts, which blocks the nasal passages from the pharynx. The laryngeal muscles contract, closing the glottis at the top of the trachea by tightly aligning the vocal folds. The epiglottis swings down upon the closed glottis. With all airways blocked off, respiration is temporarily inhibited. As the upper esophageal sphincter relaxes, pharyngeal contractions drive the bolus into the esophagus. The oropharyngeal stage is done and breathing resumes. During the esophageal stage, a primary wave of peristalsis initiated by the swallowing center pushes the bolus through the esophagus. As the bolus travels through the esophagus, the lower esophageal sphincter relaxes, allowing the food to enter the stomach. If the bolus is sticky and adheres to the esophagus, secondary peristaltic waves triggered by the intrinsic plexus at the point of distension completely clear the esophageal lumen to finish the swallow.
The reason swallowing is so important, it's just really critical that if your vocal cords aren't working properly or there's some kind of paralysis, you will not be able to swallow adequately. And a lot of the folks that we support are going to have difficulties with swallowing and breathing, and all of those things are really, really complicated. Sucking, swallowing, breathing, all of those things are difficult to coordinate as an infant, and as we get older, it's really important to understand that the swallowing process is very, very critical, because learning how to chew and swallow, if it's not done with safety, then a lot of the folks we support will aspirate on their food, and then they get repeated respiratory infections, which is going to affect their ability to communicate. So when we look at speech disorders, they're broken into articulation disorders, disfluency, apraxia, and aphasia. So simple articulation disorders, there can be distortions in speech or omissions. So a common distortion is putting TH instead of S. So instead of saying sleep, sometimes it's a dental issue. So a distortion could be thweep. So think of TH instead of S. I'm going to thweep now. Very common. A lisp is a distortion of the Z sound. So you can make an S sound, and then while holding on to the S, try to turn it into a Z. And that's very, very common. And then a frontal lisp is when the tongue pushes forward and the Z sound or S sound is more like TH, like I'm playing soccer on Saturday. So that's a very common distortion. Often it's because I'm missing my two front teeth. So there can be distortions, omissions, substitutions, or additions. Often W is used instead of the letter R, so the wed, wabbit, wan down the woad, very common. Elmer Fudd used to do that. Sometimes TH will turn into an F, so thing or think becomes thing, think. I'm just thinking about it, Mum. Let me think. And L turns into a W. Let me think. Let me think about it. Omissions sometimes are even just a one-letter omission, like number or effant instead of elephant. They'll miss a whole syllable. So here's a little girl working with a speech and language pathologist who teaches her how to say the word ear.
Today I'm teaching Grace how to say the R sound. Okay, Grace, this is Mr. Mouth. This is what your mouth looks like, only bigger. Okay, so I want to tell you the difference between the old sound. The old sound is the, look at my mouth. The old sound is the W sound. You move your lips to make the old sound. But for the new sound, you pull your tongue back and it rests in between these big teeth back here. Can you feel in between your big teeth? Now further back, look, back here, not the front ones. Yeah, back. So pull your tongue back there and say, ear. Ear. Oh, take your fingers out. Now try.
Ear.
Good. Now make it faster. Ear.
Ear.
Good. So for the old sound, we use our lips. Wah. For the new sound, we use our tongue. Ra.
Disfluency is also known as stuttering. Disfluent speech can be marked by stoppages in speech, repetitions, unusual pauses, atypical rhythms. Stuttering is the most common type of disfluent speech. So if we consider somebody to have disfluent speech, it's because 10% of the speech or words are stuttered. Stuttering affects individuals of all ages, but it most often is in young children and very common in boys, 3 times more likely for boys to stutter than girls. And most children do outgrow their stuttering, so really only about 1% of adults stutter. The types of disfluent speech, this will vary from time and speaking situations. So often when there's a more complex topic or something that's unfamiliar or uncomfortable, people will have disfluent speech. The other thing is when there's an expectation that the person take turns. So if you're talking on the phone, for example, and you say something and then it's their turn to say something, when there's an expectation that they have to say something, that can be quite stressful as well. They're more fluent when they're talking out loud to themselves or when they're speaking in a monologue kind of a voice, or singing. Sometimes people can out-sing their disfluencies. So it really depends on who they're faced with. So non-threatening things like a baby or a household pet, or facing a subordinate or a colleague as opposed to facing a boss. So it really depends on the stress level. So stress definitely can increase the stuttering. So there's part word repetitions where the first letter is repeated, like it's time we were going, or the whole word repetition, like I, or phrase repetition. So why are you, and sound prolongations, which are also known as stammers. So the first letter is dragged a little bit, like Jim or deluxe hamburger. So sometimes there's interjection of sounds or syllables, and these are like bridges. They're words that we bridge, or the person with disfluent speech would use as a bridge to get from one part of the sentence to the next part of the sentence. So it acts as a bridge that they can leap over. More examples, there are silent prolongations. So that's when you're struggling to say a word and there's no sound that comes out. Or a silent pause between words and sentences that is considered just to be a little bit too long. Or a broken word. So that's a pause between words. It was a wonderful. And this is somebody who has actually learned how to stutter and made a very good living at it his entire life. I really enjoy this.
Count out the sounds. Eba, be, boy. Okay? So it's 4 sounds in the word. Chair. Desk. Now, you wrinkle your nose, you make it kind of nasal, and it's boy. And then for the third sound, you push it more. Boy. Chair. Desk. And then you have to put together full sentences. The boy sat in the chair next to the desk. And nobody can do that, and that's when I have job security.
He made a living being Porky the Pig. So what do we know about people who have disfluent speech? Well, the interesting thing is that the auditory cortex is the part of the brain that is resonated here, listening. So when we speak, we self-listen, and you can see that the non-stutterer or the person with fluent speech has a very active auditory cortex, so they're self-listening. Okay? Whereas in this part of the brain, we notice that the person who stutters and has disfluent speech, their auditory cortex is much, much less active. And we're not quite sure, is it because the disfluent speech, the person with disfluent speech is not enjoying listening to their own voice, so they purposefully don't listen? Or is it because they hear it really well and they choose not to listen? So we're actually not sure which it is, but we do know that self-listening is minimally used by people who stutter. So activation in the hearing center, the temporal superior lobe, is much, much weaker in stutterers than in non-stutterers. And so whether this is a cause or whether it's a compensation, we're not quite sure. So how do we support somebody that stutters? It's really not helpful to make remarks like, oh, relax, it's okay, like, you know, I can wait and there's no hurry, or don't finish their sentences. The best thing to do is sit down, just sit down and relax. So don't stand over them, you know, listen and maintain eye contact and try not to be impatient, and then you be really relaxed and chill in your responses. Don't speak quickly. When somebody's on the phone, be really patient, because you know that that's a difficult time for them. Let them know by your actions that you're listening. You know, you might be tempted to fill in the blanks, but try not to do this. So just some definitions here. Apraxia is basically difficulty initiating and executing the voluntary movement patterns necessary to produce speech. So there's no paralysis or weakness. It's actually neurological, and it involves the brain's programming of the upper articulators. People who have difficulty producing the desired speech sound and using the correct rhythm and rate of speaking, that's considered apraxia. And then aphasia is slightly different. This is the impairment of comprehension. So not using or comprehending language and often it's due to people that have had tumors, infections, strokes. It's usually blood supply that has interrupted the blood supply to the brain. Difficulty retrieving words, writing words, reading sentences, and it can be very, very difficult to communicate. Some of the things that you can do is use word and picture matching, and sort of use a target word and then cue the name. Learning sort of communication methods using writing or gesturing or some augmentative communication strategies are really helpful for people with aphasia. Oral apraxia is a little different. This is non-speech movements, so we need to have control over our mouths for kissing and chewing and passing a grape from the left side of your cheek to the right side of your cheek and blowing out bubbles and blowing out a candle. And so oral apraxia is the inability to carry out non-speech movements. Signs that somebody might have oral apraxia would be drooling or crumbs on their lips and mouth, mouth breathers, or people who have are able to chew only on one side of their face, for example. And dysarthria is another definition. This is people who have slurred, slow, and difficult to produce speech. If you watched the video that I shared about the social model versus the medical model of disability, I believe I shared that just before your online midterm test. There was a gentleman who was interviewing Dr. Frazee. He had dysarthria, and it's a very common cerebral palsy accent. So it's usually paralysis, weakness, or an inability to coordinate the muscles of the mouth. And it sounds a little bit like this. And you, after a while, can totally understand somebody with practice. And I don't mean to imitate or mock anyone. I've worked with a lot of people that have, it's almost like a cerebral palsy accent. So I'll make sure that that you have that sample. If you want to hear it, it's, I think his name is Norman Kuntz, and he's an interviewer, and he has a whole series called Conversations That Matter, and he interviews people with disabilities on their perspectives, and he himself has cerebral palsy, and it makes people sound as though they're not fully cognitively functioning, but they totally are. So to improve different oral apraxias, oftentimes you'll see speech and language therapists working with children and getting them to blow bubbles and kisses and kissing in a mirror and using straws. And speech and language pathologists are often around during mealtime. They watch how children chew and suck and swallow. And it's really, really important that you have a speech and language consult for any children that you think are having difficulty, because these things can be improved. That's it for today.